Hi, my name is Ashlyn and I work in digital healthcare, and this is a quick guide on design thinking. Often we have staff approaching our team asking about adopting digital solutions. They have the desire to solve a problem, but it's often hard to find the right solution or even know where to start. This is particularly an issue in healthcare where we are often faced with complex systems. Our first recommendation is that when you're looking to adopt a digital solution, don't do this in isolation. The digital solution may be used to enable a service, but it should not be the driver. It should be pulled into service design rather than pushed into it. And often we see services trying to push digital solutions in, and rather than enhancing the service, it actually causes more burden, often leaving staff disillusioned around the real benefit digital health solutions can bring. So as a team, we're advocating and turning to design thinking. Design thinking is a process that seeks to solve complex problems by approaching it from the user perspective. It's about taking a service and making it meet the user and customer need for that service, starting from when they're referred to when they're discharged. It can be used to improve an existing service pathway or to create a new service from scratch. Then wrapped around that, we will then find the digital solutions to further enhance your pathways. The design thinking framework can be broken into 5 actionable stages that make up the design thinking process: empathize, define, ideate, prototype, and test. In the empathize stage, you'll get to know your target audience and paint a clear picture of who the users are, what challenges they face, and what they need. This can be achieved through interviews, user testing, surveys, and talking to people to understand how they think, act, and feel. Based on what you learn, you'll move to the second stage and define your problem. When creating your problem statement, it's important to focus on the user's needs over the business goals. Keeping it person-centered is key here. And if you find you're starting to trail off or get lost in your service development, look back at your problem statement to refocus. Remember to keep in mind innovation is rarely born alone. So don't fly solo. Get and gather key individuals from other teams and services to help you ideate. The name of the game is to think outside of the box, explore new angles. There are many techniques to get you and your team started, so ask the digital health team for more information on running a design workshop. Design thinking is about looking for creative solutions and ways of delivering care. So you have your pathway defined. Next is to start the service. But do this as you would a prototype and test. Seek feedback, work with service users to get insights. Does the pathway need tweaking or more work? Feedback will help you make changes and improvements. Although these steps appear to be sequential, keep in mind design thinking is less linear, but a constant building, refining, and improving process. At each stage, you'll most likely discover new things that require you to go back and review. If you would like to find out more about design thinking and digital health, please contact the digital health team.